Help with Sheila's question a little bit. We'll see. So my name is Nyle, and I do specialize in chronic illnesses. So a lot of patients who come to see me have kind of been through the ringer, and by the time they get to me, they're in debilitating chronic pain. They're stuck in pain cycles, and a lot of it comes back to the fascia. So I'm going to talk about two things today. The first one is fascia, because I think a lot of people don't know what that is, or if they do, they don't have a full understanding of it. And it's totally understandable because up until 2018, the medical community didn't even recognize it as its own organ. So I'm going to share a slide with you. It's going to be a little, it's in vitro, meaning it's a real life slide that was taken from a real living person through a scope, a camera through a scope. So, just a little content warning. It might have some, viscosity to it and some blood and all that good stuff. So if you're not sure you want to see that, I suggest maybe covering your eyes, and I'll give you a warning when I show it. The second thing that I really want to convey here is that the body does store emotion and trauma. So raise your hand if you know that's true. Okay, we're not doing too bad here, 50-50. That's way better than when I first started practicing, over a decade ago. My patients were like, "I'm sorry, Nyle, I just don't believe in that woo." So we're getting better. And I do think a lot of it is thanks to our diagnostic testing and our ability to go into the body and see what's truly, truly there. So it starts with fascia. And to answer Sheila's question, why do you need to care about this stuff? Well, the reason is because if we are not accessing and opening the fascial webbing inside of our bodies, we are creating stagnation of the tissue. And what do we know about stagnation? Stagnation leads to illness. It leads to chronic illnesses. So, Dr. Kogan, I would actually venture to say I don't think it's just, the electromagnetic storms or anything like that. I think that we are, as a society, in a place where we have been stagnant for almost 2 years now, you guys. Almost 2 years. Our occupations have been stripped away. We've been forced to sit at a computer and do our daily routines with the forward head posture, and that's creating stagnation in our tissue. In fact, in the last time I was here, I talked about something called dead butt syndrome, where your butt literally dies out from underneath you from all the sitting. So all of that has an effect on your fascial webbing, and I'm going to show you what all of that is now, and then I'm going to tell you what you can do about it. So if you really want to start to change your immunity, start here, okay? And then everything else you do will start to get in. The food you eat, the meditations you do, the exercise you practice will be more effective because you're creating flow in your tissue. All right, are y'all with me so far? Okay, good, lots of bobbing heads. Okay. All right, so Tatiana, if you could go ahead and share that first slide now, I'm going to show everyone the fascia. So this is the content warning I spoke about. This is really exciting because Jean Gambertou, who is a plastic surgeon, he figured out a way to record living, breathing fascia. Up until his work, we were only ever able to see dead cadaver fascia. And once the fascia is dead, it kind of just looks like if you ever eat beef jerky, like old school beef jerky, and you rip it apart, that sound it makes, the stuff that is kind of pulling the beef jerky apart, that's fascia, but that's dead fascia. And that's the fascia you end up with when it's sticky and dehydrated. However, when it's still in your body and alive, this is what it looks like. And so you can see here on the slides, it's actually very viscous, otherwise known as lubricated. And inside of those little strings, it's actually hollow. Those are microtubules, almost like telephone wires that conduct information between what they're connected to and what is up against that connection. So let's say in the top left-hand corner, for example, up here, let's say this is fascia that rests along a muscle, and it compartmentalizes the bicep muscle and keeps it separate from the bones. So this has to be lubricated and open in order to allow for the bicep to slide and glide along the bones. And then if you go down here in the bottom right-hand corner, for example, let's say this, yellow looking stuff here is probably adipose tissue or fat tissue. So let's say this is fascia that surrounds the intestines. And when it surrounds the intestines, it's known as viscera. So let's say this tissue down here is the viscera around the intestines. See how it's very open and lubricated right now. If it was dry, if it was thick and dense and dehydrated, then what it is surrounding wouldn't be able to mobilize or move. And every organ in the body needs to have movement. It's known as motility when it moves. So if the fascia is sticky, the organ loses motility. And if the organ loses motility, that organ then can't pump life through. It can't beat, it can't move food through, it can't do its job. So it all comes back to fascia. The last thing I want to tell you about fascia right here, if you look on the right-hand side, these are all the different names of what you'll know fascia to be. The mesentery is the fascia that covers the intestines. The dura mater is the fascia that covers the spinal cord. The dura mater covers the brain. The dural tube covers the spinal cord, and the pleural cavity covers the lungs. Do you think those are important structures in the body? The extracellular matrix, this one is really exciting because that's the one that was actually discovered in 2018, where scientists found that through the process of technology, they were able to look inside of the nucleus of the cell. And inside of the nucleus of the cell, they found fascia. So Tatiana, you can go ahead and unshare this one for a minute. Why this is relevant is because at the end of the day, we are made up of fascia down to the cellular level. So if the fascia is not open and conducting information, our cells are not functional. All right, do I have your buy-in now on why this is so important? Okay, good, good, good. All right, so great. Now, how does that result in holding stress and emotion? Well, have any of you read any books on how the body stores trauma or emotion? And if so, could you type them in the chat there if you know of any books at all? And for those of you who this is new information for, maybe this will be a great jumping off point for you to start to understand this mind-body connection. So the body keeps score. Yes, that is the most popular one by Bessel van der Kolk. It's probably going to pop up there a few times. Another good one, I'll type it into the chat. Yes, Chasing the Tiger. Thank you. That was the one I was going to type in by Peter Levine. The Body Bears the Burden. Beautiful. You all, thank you so much. I'm going to suggest just one more that may not be on your radar. It's called The Elephant in the Brain. And I can type that in the chat too. Okay, the transformation, excellent. So molecules of emotion, thank you, Suzanne, that's a really good one. My Grandmother's Hands, also a really good one by Resmaa Menakem. That one talks a lot about somatic and like cultural somatics and how racism actually gets stored in white bodies and Black bodies. This is so good. I am so impressed. I have to tell you, 10 years ago, I never, this was not the response I got at all. So I'm very, very grateful that this is starting to become on people's radars. Now, I want to take it one step further and talk about something that even these authors don't talk about, which is not just the fact that trauma and emotion is stored in the body, but specifically why. All right. I showed you the picture of fascia. You see that it's these beautiful tubules, these great conductors of information. Those tubules inside are hollow, but they actually, just like the rest of our body, store fluid. So they're fluid filled. And inside you have little DNAs floating around. And all of that contains information. That's why generationally we inherit our family's trauma because it's stored and passed on generation after generation in the fascia. And then it becomes our posture. That's also why oftentimes our posture mimics our parents' posture. Our chronic pain patterns mimic our parents' chronic pain patterns. I treat generations. I'm a pediatric OT by training, so I treat children and I treat their parents. And I see this in the clinic historically. So Tatiana, if you can pull up the other slide now, I can show you a little bit more about how the body stores trauma and emotion. So emotions and the physical body. The number one takeaway here is the emotions go to the site of greatest restriction in the body or greatest resistance. So if you have places in the body that are constantly in pain, that are your chronic pain places, they become like a sponge for your stress and emotion. And that's what keeps you stuck in a vicious cycle. The body needs flow. I'm just going to read to you something here on a pamphlet that I'm going to show you next, which is about understanding your organs. The body retains the memory of trauma, whether it's physical or emotional. In intense stress situations, the brain passes the excess stress onto the organs, whose fibrous matter immediately records the emotion. This sets off a psychosomatic reaction. The human body is the seat of a permanent emotion, organ, behavior, organ cycle. So emotions go to the organs, then the organ becomes that behavior that the emotion stores. And I'm going to talk about that next. The last point here is the viscera and emotions. So Tatiana, you can go ahead and unshare, and I'll show you about viscera and the emotions. So viscera, as I mentioned, is what fascia is called when it surrounds the organ. Every organ in your body has a function, right? Every organ in your body also has a movement. They all move. That slight movement is what keeps them functional, okay? And I am a fascial specialist, so I have every organ's movement memorized. And my job when you come to my table is to help jumpstart that movement in the organ for you again so that it can function. Now, one of the things I'm trying to teach in this new virtual world we're in is how patients can start to facilitate and jumpstart their own movement and their own flow. Maybe not organ specific necessarily, but more body, more globally myo or muscle fascial specific. The one thing I will say about the organ specific though is even if you can't feel for the movement, you can increase your awareness around the things I'm telling you now. So if you have an organ that tends to be kind of your, I don't want to use the word problematic because words matter, but the organ that's often on your radar, the one that you're often dealing with, then there's probably something to that. There's probably some emotion and undealt with karma there. So I'd like to help you out with that now by bringing that awareness to the surface. Does anyone have an organ specific that is constantly on the radar? Something that maybe they're constantly having checked at the hospital or with their healthcare professional or wellness professional, something that has like inherited, you know, you're always writing down on the medical forms. It's like something that your father and your father's father and your father's father before him has dealt with linearly. Or lineage wise. This could be like heart disease, so lungs, cardiovascular, pancreas, liver, spleen, kidneys, anything, right? We have eyes. So throw in there a few more, any organs that you've just have been on your radar your whole life. This could be breast tissue. This could be stomach, digestive, kidneys, brain, lungs, anything. Good, good. Thank you. IBS, intestines, absolutely. Colon, liver. Eyes is coming up a lot here. Maybe I do need to talk about that one. Digestive. So I'll talk about digestion. What I read off of when I was showing the last slide is this little pamphlet here, and I don't expect you to be able to see, but this is something from the Barral Institute. Jean-Pierre Barral is a physical therapist who created the method called visceral manipulation. And that's one of the things I'm trained in. Visceral manipulation is releasing the fascia of the organ. And in this great little pamphlet here, he talks about all the different organs and the function, the motility, all of that. But he also talks about the emotion that's stored in there. So I'm going to share with you the emotion that is stored in the intestines. And I will talk about the eyes, but I want to add a little disclaimer here. I may, oh, I'm good on time actually. And let me know if I'm talking too fast, by the way. I'm trying to cram it all in as usual. So before I talk about the emotions of these organs, I just want to give a little trigger warning here. If you are feeling emotional from this, and emotional could be angry, frustrated, denial, grief, relief, those are all different emotions, right? Not good or bad, just emotions. We're going to take away the judgment. They're just emotions. If you feel an emotional charge around what I'm sharing, there's probably something to that. And now we know all that means is that's in there. And I'm going to show you how to bring it up so that it doesn't take over your life and keep you stuck in that chronic pain pattern. All right, so let's talk about the intestines first. Are you all ready? According to Jean-Pierre Barral, the emotions that are stored in the intestines, and this includes the large intestines and the small intestines. This does not include the stomach, that's a separate organ. The emotions are tendency, oh, and these can also be behavioral patterns because it keeps you stuck in these behavioral patterns. Tendency towards exaggeration and theatrics, slightly obsessive, certain rigidity meaning stuck in your belief systems, mood swings, insensitive and thin-skinned, inclination towards paranoia, and great generosity, very giving. Okay, so that is somebody who has fascial restrictions in the large and small intestines. Those are different behavioral patterns or karmic patterns that play out in those in those people. Now, the stomach is slightly different. People who have fascial restrictions in the stomach organ, someone who's constantly getting the stomach, which includes the duodenum, which is leading into the stomach. If you have restrictions there, it's often social stress or fear of loss of stature. What am I doing? What am I not doing? You know, constantly stuck in that pattern. What am I doing? What am I not doing? Appearances and self-image, the power of extroversion, they're very extroverted. Poor self-esteem, lack of self-confidence in childhood specifically. Marked ambition, they take action. They sometimes are like overactive. Unstable with arrogance or altruism, fear of or inability to bear failure, feeling powerful or, feeling powerful to self-deprecation, spontaneous anger, and they need a lot of extra time to get over strong annoyances. All right, I'm going to do the eyes, but let me talk really quick about breast tissue because I think that one's really important. I work a lot with breast tissue around releasing stagnation around the breasts. That carries a very maternal caregiver sort of karma to it. It holds a lot of guilt, a lot of feeling like taking on the responsibility for the household and for the family. There can be a lot of grief and sorrow and loneliness in the breast tissue. Unfulfilled wish to have a child, feelings of guilt and failure, submission, shyness, difficulty finding your place, and some relationship and instability with the mother. All right, let me talk about the eyes really quick. That one's not actually listed on here, but it is one that I work with a lot. And you'll be, this might be helpful to know, it's not actually the fascia of the eyes that where the restrictions lie. It's fascial restrictions in the base of the skull. So if you're having a lot of eye pain or diplopia, like double vision, or kind of movement, nystagmus, where the eyes kind of move around, it's often because the back of the skull is restricted. It's the base of the skull, the occiput, that holds the cranial nerves that control the eyes. Okay. So you want to create movement in the back of the head. And I'm going to show you how to do that now. So in these last 5 minutes or so, for those of you who would like to join me in this, we're going to move. Now, I want to say, we've been sitting and you've been listening to me this entire time, but there's a ton of value in the awareness factor, in just increasing your awareness that the body does hold emotion, and specifically in those organs. Oh, sorry, let me speak to the karma of the eyes. The karma of the eyes often has a lot to do with identity, okay? Making yourself small, making yourself not seen. And if you're having, stuff going on around that right now, it's because you're either shifting into a new awareness around wanting to be seen, or your body is just tired of being in that state. So if you look at the posture associated with this kind of crunching your neck and the head down in to make yourself small versus being big and open and tall, that has a lot to do with identity. So the eyes have a lot to do with identity and being seen in the world. Okay. So again, I'm going to just say, if any of those lists of emotions resonated with you, it's probably because that part of the body is like, oh my gosh, they see me, yay. And so much of this is just about the recognition, acknowledgement, and awareness. And then beyond that, bringing movement and breath into the body. So starting today, I have a challenge for everyone in this group. I'm going to post this link because it was shared a little earlier up, but then there are a bunch of questions. So I'm going to share it again now. In the chat here is a link for a body scan worksheet. Please open it up. I'll even give you a second. Open up this link and print it out, because after today, you won't have access to it anymore. It's not publicly advertised on my website. This is something I only offer to people who work with me through my coursework. Now, if you are interested in working with me and in more depth, if you're like resonating with all of this and you really want to go deeper with understanding how to treat your body, I am doing a free or donation-based pain relief clinic in September. The dates are September 17th through September 20th. That is on my website, which is blueniletherapy.com. I'll type it in the chat too. And then you can probably find this on the recording and stuff later. blueniletherapy.com. If you go to the events section, you can see it's a free or donation-based clinic all about relieving pain. And you'll get access to this worksheet again, along with some other ones. But what I teach people is how to move intuitively and reconnect with the parts of the body that are stuck in chronic pain cycles, and how to break through. And I'm going to show you a little bit of that now. So go ahead and open up that worksheet. And I'm going to open it as well. And if I can share. No, I won't share because I want you to be able to see me. Never mind. Okay. So if you have the worksheet open, you'll see that it has a figure of the anatomical figure on it. And then at the very bottom, it has a list of questions that you can ask of the body. Here's your homework assignment. Every single day, you are going to get up in the morning. You're going to put on some music instead of the news and instead of your phone. Okay, Dr. Kogan? You're going to put on some music, preferably music that makes you want to move. You're going to pull up this assess worksheet and go to the bottom where it has that list of questions. Then you're going to begin to move your body and scan your body and ask those lists of questions. And I'm going to give you some ways that you can move now. And for those of you who would like to do this with me, I invite you to stand up and do this with me. You don't necessarily need to see the screen. You can just listen to my words. And if you don't feel like you quite have a handle on what I'm going to show you now, you can also find a video of this also on my website. So BlueNileTherapy.com, under the resource page, I have a video of jiggling and a video of unwinding. So you can watch those, but I'm going to show them to you now. So if everyone has that sheet pulled up, go ahead and stand. Take a slow breath in, a slow breath out. Soften your knees, soften your hips, even put your hands on your hips, and then just start to kind of bounce. Pretend like your knees and your hips are springs, and then begin to sway side to side a little bit. Take a slow breath in, raise your eyebrows up. A slow breath out, relax your eyebrows down and scan your body for what is not moving. And that's one of the questions on the assess worksheet. Wherever in your body is not moving, I now want you to start to jiggle there. So for me, it's my neck. And Sheila, if it's in between your eyes, you can raise and lower your eyebrows a couple times. Also put your hand on the back of your head and see if you can just create a little movement in the back of your head. And those of you who typed in an organ, I want you to place your hands on that organ now. For your stomach, it's on your left side under your rib cage. For your intestines, it's right under your belly button, maybe even a little lower. You could put your hands on your chest or down at your organs, your pelvic organs, if it was your reproductive organs. Let me see if there's any other ones. The liver is on the right side under the rib cage. So scan your body in any place that's not moving. I want you to just start to jiggle there now. So movement is the first way to create flow in the body. And through this movement, we're actually breaking up superficial fascial adhesions. The way this works is the body is, let's say, 60% water, give or take. When you begin to jiggle, you're disrupting the water in your body. And imagine now if you had music on in the background and try to find a beat. So start to move to a rhythm, pick your own, and make that movement a little bit bigger. Bring it down into your arms now. This is why we need music. Now, if you have a rhythm, imagine what's happening inside of your body to that water. It's picking up inertia and it's crashing against those tight places in your body. I want you to bring awareness to a tight place in your body again. And imagine that water crashing up against those fascial adhesions around the spine or the organ or the eyes or the back of the head or the shoulders or the hips, and bring that movement into that part of that body with intention. I'll repeat again, the stomach is on the left, the liver is on the right underneath the ribs. You can start to just move your hips and move your ribs. And these are all things I'll teach you a little more specifically in that pain relief clinic. But just for today, I want you to know this is yours and it's available. Now come to your breath and slow down the jiggling and start to turn it into wave-like motions, bringing your arms up. Come into the center of your spine and start to move your spine very slow. You can start down in your pelvis because that tends to be a little safer for people. Move your pelvis and your hips. And then start to bring that wave and that movement up your spine a little bit. And now here's the next question. Where is the pain? So this is another question on your assess worksheet. Now begin to move all around the room. So step away from the screen and challenge yourself to move your feet around the room a little bit. Stay with that slow, fluid-like movement, letting it derive from the center of the spine and out into your arms and legs. Now, another question is, what is not moving in the body? And whatever's not moving, I want you to move from there. Let all of the movement originate from there. So if it's the neck, move the neck and start with the neck. And then add an arm, another arm, your face, your torso. And then the last question we're going to do here is, what's connected to the place that's not moving in the body? So if you have the neck, what's connected to the neck? Whatever place that is, start to move that place now too. Take another slow breath in, slow breath out, and breathe into that space you're moving. And you can begin to slow the movement down and come back to the screen if you're not already. Now, if you're doing this on your own, when you do this on your own, you can actually write on that worksheet what came up for you. So my suggestion is look over those questions at the bottom and use those two techniques that I just showed you. They're called rebounding and unwinding. And you can find the video tutorial on BlueNileTherapy.com. And if you'd like more guidance around how to move in ways that are a little bit more mindful to the body, keeping in mind that not everybody's body moves the same way, then I am offering a pain relief clinic in September. So you can find all that information there. Okay. Lots and lots of resources for you, but really just move and make it a daily practice. This can be a 5-minute thing, like two songs.
Nyle, Linda's asking if you're breathing through the mouth or nose.
Oh, so with the breath, that's like a whole separate thing. I would say breathe in through the nose, breathe out through the mouth. And this is just about noticing right now, Linda. Notice what feels tight, okay? Oftentimes the breath feels very tight because of the fascial restrictions. And then we start feeling really frustrated around that and we try harder, and trying is the opposite of what this is about. It's about noticing. The body wants recognition, right? In through the nose, out through the mouth. Don't worry about the rest. If you find yourself overthinking, go back to one of those questions. Those questions are specifically designed to get you into your body and out of your head. Thank you for that. Yay. Good. Oh, and one last thing I'll say is, if you're noticing more now, like my knee is kind of feeling a little tweaky, that's the stuff coming up that's already in there. It's the stuff coming up to be healed. So the way through that is to move a little bit more and move a little bit more slowly. And then the next step is to self-treat. And again, all of that's covered in this pain relief clinic. So, and I'm sure I'll be back to talk about this another time later, but this is just kind of introduction stuff.
Thank you, Nyle.